Hi, good morning Paulson. My name is Mihiraa. I'm your invigilator for the OET speaking session on the 15th of June 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Paulson Murray.
And what is your candidate number, please?
My candidate number is 233349193.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
Thank you. So let's start with warm-up questions. The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
Give an example of a time you had to interact with a hostile patient. How did you handle the situation, and what was the outcome?
Unfortunately, hostile patients often are part of the job. It's important to remember, some of the patients are being hostile because they are in pain, away from family, and in the hospital setting. There was a time, a patient refused to take her medication. I tried everything, but she would spit them out at me when she tried to take them. Because of this behavior, I involved my charge nurse, the physician in charge of her care, and the social worker. After many conversations and phone calls, it was determined the patient was spitting the medication out because she liked it mixed in chocolate pudding. The woman was elderly and suffered from dementia. It was only after speaking with the social worker did we learn of her medication preference. She was not able to communicate with us her wants and needs, and this led to hostility.
Tell me about a time you were under a lot of pressure. What was going on, and how did you get through it?
I was the most senior nurse in the unit by over a decade. I had to not only handle my patient assignment, but I also was to act as a resource to the other newer nurses on the unit. I had to make sure my time management was great, as well as my ability to drop everything and help someone else. I had to stay organized, otherwise, I would not have been able to assist others.
Tell me about a time when you didn't know the answer to something at work. How did you go about finding the information?
As nurses, there is no way that we possibly can know everything. Knowing who to go to for help is the first step. At the beginning of every shift, I identify a nurse that I can use as a resource, such as a charge nurse, nurse educator, or unit resource nurse. This individual is generally someone that is more senior with an advanced skill set. If I am unable to get the answer from them, or they are busy, I look at the healthcare system's policy and procedure manager. If there is a concern regarding a medication dosage or interaction, I look to LexiComp.
Talk about a time when you had not communicated well. How did you correct the situation?
This often happens when there is a language barrier. I learned that it is always better to ask for an in-person interpreter or utilizing a computer translation software. This ensures there is no miscommunication of information. Unfortunately, hand gestures and speaking louder doesn't always work.
Describe a time when you went over and above your job requirements. What motivated you to put forth the extra effort?
I personally feel like I give 110% to all of my patients every shift, but there was one that I grew especially close with. For some reason, the patient had been dropped off by a family member, and no one had come to see the child for months. It was obvious the patient was missing key developmental milestones and was becoming increasingly lonely and depressed. I asked to become the primary nurse for the patient, which meant every time I worked, he would be assigned to me. I worked with him over several months to get him potty trained and to improve his vocabulary. I don't know exactly why I was extra motivated, but at that time in our lives, the patient and I needed each other.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your role play. Don't worry if I stop you when the time is up.
Good morning, Rena. Good to see you again. I am your attending nurse Paulson here. How are you doing?
Good morning, Paulson. I am doing well. Thank you for asking.
Happy to hear that. Well, Rena, how may I help you today?
Nurse, I am here because the clinic has sent me a letter to say that I had to have a vaccination.
Oh, all right. Can I confirm that you have received the appointment letter for Pneumococcal Polysaccharide Vaccination, that is PPV?
Yes, nurse, it is correct. But I don't think I need to have it.
Thank you for your confirmation. I acknowledge your concern, Rena. I can explain to you why you have received the appointment for PPV.
Okay, I would like to know about it.
Sure, Rena, you received the letter since you are having rheumatoid arthritis. Rheumatoid arthritis patients are at higher risk of pneumococcal infections, which can compromise the immune system.
Oh, I see.
Yes, Rena, it is. The infection can range from ear and sinus infections to pneumonia and septicemia, which is infection through the bloodstream, thus making the immune system weaker than expected and not functioning properly.
Really? But nurse, I always get an annual flu jab, which I thought would be providing enough protection.
Your concern is quite reasonable, Rena. Can I clarify it for you?
Definitely, that will be helpful.
The PPV vaccination is just for pneumococcal bacterial infection. It doesn't act on any other infections. Since the infection-causing bacteria remain constant, PPV is given every 3 years. Perhaps, the flu vaccination you are receiving annually is for other viral infections. The point to be noticed is that, here the flu strain constantly changes, which makes it essential to be given yearly. I hope it is clear to you.
Yes, nurse. Now I understand that.
That's perfect. Do you have any concerns?
Yes, nurse. Is there any chance that I am likely to feel unwell after the vaccination?
Your thoughts are quite reasonable. For your better understanding, I will outline the possible temporary mild side effects, which you may come across after the vaccination.
I would like to hear about it, nurse.
Rena, there will not be any serious side effects. Sometimes, you may experience a slight temperature after the vaccination. Also, redness or swelling at the injection site is normal after taking PPV.
Okay. And nurse, what if I feel something serious?
Rena, I appreciate your consciousness. In case you feel unwell after the vaccination, I strongly recommend you to make an appointment with your GP.
Sure, nurse. I will take care of it.
All right. Please let me know if you have any other concerns to be addressed by me.
Actually, nurse, I had my annual flu vaccination just 2 weeks ago. So, maybe it is better to wait before I have another vaccination.
Well, Rena, before clarifying your concern, I would like to know whether you had any reaction to the annual flu vaccination, please.
No, nurse.
Reactions in the sense, high temperature, muscle aches, fatigue, anything like that?
No, nurse, I felt fine after the flu vaccination. It didn't cause any problems at all.
Glad to hear that, Rena. In that scenario, I can reassure you that it is completely safe to have the PPV today.
Oh, I see.
Yes, Rena, I can assure you that your PPV will not have any adverse reactions to the flu vaccination. Moreover, you have attained a suitable interval since the earlier vaccine.
Okay, that's fine.
Rena, can I get your consent for the PPV?
Sure, nurse. It is okay for me to have the vaccination today.
Thank you for your consent, Rena. I really appreciate your decision.
Thank you. That is the end of your OHT speaking roleplay. All the best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.